From adamantly refusing to fly Kenyan students stuck in Wuhan home in the midst of the coronavirus outbreak to being forced to suspend flights to China. From secretly allowing China Southern Airlines into the country to allowing 239 passengers from the flight to disembark with the advice to self-quarantine. Is the Jubilee administration on top of the looming tragedies, or is it clueless? Hello there, and welcome to this special edition of Meet the Press on Metropole Debrief. My name is Ndiro Ganga.
Coronavirus has put the world on high alert, but here in Kenya, caution on the virus heightened on Wednesday with the arrival of a China Southern Airline flight that landed with 239 passengers on board from China. The 239 passengers were allowed to disembark the aircraft with instructions to self-quarantine for 14 days, a move that sparked off public outrage and questions over why the passengers were allowed to enter the country. Since then, a number of Kenyans have gone ahead to safeguard themselves against the disease by wearing face masks, with the surgical masks and respiratory masks being the most purchased. Chemist owners in Nairobi, whom we spoke to on conditions of anonymity, now say there has been increased demand for the masks that has in turn led to a shortage of protective masks in the country.
People have already bought most of them from most distributors. So actually there is none from any of the distributors. We are going for 250, a box of 50 and 500 bob, depending on the company they come from. Yeah, and we expect a price change when they come back if the coronavirus situation persists. It might go up to like 500 to 750. Yeah.
The state body charged with availing medical supplies to public health facilities in Kenya, the Kenya Medical Supplies Authority, has however allayed the fear of a shortage of face masks in the country, saying that the government is already procuring an additional 2 million masks. KEMSA Chief Executive Officer Dr. John Manjari has said the move is part of measures to enhance the country's preparedness in case of an outbreak, adding that should the need arise, the government will procure more masks to cover as many Kenyans as possible in high-risk areas.
It is the high-risk areas that we need to, especially in hospitals, because if you get a patient who comes through the airport at the point of entry direct to the hospital, then the people around the hospital need to be more protected, not every other Kenyan that is doing their normal activities.
In addition to procuring the mask, the national government has set up a response and treatment center at the Mbagathi County Hospital. According to Dr. Manjari, KEMSA has been tasked with equipping the hospital with the requisite medical supplies to a tune of 850 million Kenya shillings.
We've been tasked to do procurements for protective gears. That is the suits, which are resistant suits for the chemicals, the masks, the hand-washing chemicals, the disinfectants, the beds, the blankets, and all those other supplies that will be required to operationalize the center.
The announcement comes 3 days after President Uhuru Kenyatta ordered that the National Isolation and Treatment Facility for cases of coronavirus be completed and ready to receive patients within 7 days. President Kenyatta further ordered that the identification and preparation of similar isolation and treatment facilities at all level 5s and referral hospitals. This is especially coming at a time when the deadly virus is seemingly spreading faster outside China, where it originated from, with 3 cases confirmed within Africa so far.
This is the Meet the Press special edition of Metropole Debrief, and you can be a part of our conversation by texting us through 20146 or logging on to our social media platforms at Metropole TV KE and sending us your messages using the hashtag Metropole Debrief. Let us now briefly do a chronological chart of how coronavirus has been developing ever since the first case was reported. Now, on the 31st of December, China notified the World Health Organization of several reported cases of pneumonia. Chinese were going to the hospital reporting that they were having symptoms symptoms synonymous to those of pneumonia. Now, on the 1st of January, the Wuhan seafood wholesale market is shut down. If we can remember, the Wuhan market is said to be the source of the virus, so it is shut down to contain further spread. On the 7th of January, the year 2020, which is the new year, the new virus is identified. The virus did not have a name previously. It's taken to the laboratory, and finally, they name it the COVID-19 or coronavirus. Now, fast forward to that, on January 11th, China announces the first death from the virus. Previously, nobody understood the virus or the severity of the virus. Now, the first fatality has been reported. On the 13th of January, the World Health Organization announces the very first case of coronavirus outside China, which is Thailand. Now, this begins to show effect of the disease and the impact because it's now spreading across the world. Fast forward to the 29th of January, and the death toll from the disease has risen to over 132 with over 6,000 confirmed cases. Now, the World Health Organization is beginning to see the impact of this disease. It convenes an emergency sitting in Geneva on the COVID-19 and declares the virus a global health pandemic and urges all countries to be on high alert. Okay, so this is what happens on the 30th of January. All countries are told, be on high alert. This could probably be a global health emergency. When this announcement is made, people begin reacting, including airlines. Now, American Airlines, Qatar Airways, and Air France went so far to suspend all flights to mainland China. Delta, American Airlines, Air France, Qatar, among many more, say we are not flying anymore to China just to ensure our citizens are safe. Now, in Kenya, nothing has been said, but Kenyans are not taking anything by chance. They begin mounting pressure on top of pressure, and finally KQ mounts to the pressure, or rather succumbs to the pressure, and temporarily suspends their flights to and from Guangzhou effective of the 31st of January, and they said this was going to be until further notice. Now, after the first COVID-19 case was reported on the 8th of December, the World Health Organization report shows that as of the 4th of March 2020, there were reported 92,000 cases worldwide, 92,000 reported cases so far. And what's the number of the fatalities? 3,200 globally from this disease. This just goes to show how severe this disease is. And if you think it's not as severe as it sounds, the disease in a period of less than 3 months has spread to over 82 countries in the world, with the United States being one of them, America, Iraq, South Korea. This map shows you just how fast the disease has spread and to which countries. Now, Thailand, just to mention a few of those countries, have suffered fatalities. Outside of China, which was the epicenter of the disease, Italy is the worst hit country with over 100 fatalities, as you can see on the map, and over 3,000 confirmed cases. However, how about Africa? Well, we are not that safe because according to the African Union, there are 6 confirmed cases in Algeria, Nigeria, Morocco, Senegal, and Tunisia, as this map shows you. So this is in North Africa and a little bit of West Africa. The first case was on the 25th of February 2020 in Algeria, an Italian national. The latest case were recorded on the 2nd of March in now Algeria, Morocco, Senegal, and Tunisia. 4 countries in one day. Okay, this just goes to show that maybe we are not as safe as we thought. And something happened that triggered Kenyans' nerves. Now, in Kenya, on the 26th of March, a Southern Airlines China flight direct from China landed in Kenya. The carrier had 239 passengers. Now, the department further stated, this is the Department of Health, stated that all passengers who were on the Chinese plane had been given the green light to enter Kenya and were advised to self-quarantine for 14 days. This sparked a crazy reactions among Kenyans and negative reactions as Kenyans did not feel safe in their own country and felt the government had not taken enough precautionary measures to protect them from any outbreak. The Law Society of Kenya went to court. Now, in the first case, the Law Society of Kenya listed China Southern Airlines Company Limited as an interested party. LSK wanted the airline barred from bringing passengers who had coronavirus into the country. Now, this is hotspot areas like China, Wuhan, and all the other countries that have been affected. Justice James Makau granted the request and barred China Southern Airline flights to entering Kenya. The High Court has suspended the flight from China for 10 days because of the coronavirus. That's what the judgment read. Now, the court also ordered all passengers who arrived in Nairobi on a Chinese plane Wednesday morning be quarantined at a military facility. All the 239 of them were to be rounded up and taken to a KDF facility to be monitored for 14 days to ensure that in case any of them is infected, the disease does not spread across the country through other Kenyans. Now, in what was termed as a reactionary move, the president then formed a steering committee to ensure that the country is ready in case of any reported and confirmed COVID-19 case. As such, KEMSA has been tasked to estimate and procure beds, masks, protective suits, oxygen, and even drugs that will ensure Mbagathi Hospital is up and running. That is the state of the nation as far as the corona outbreak preparedness is concerned. Are we prepared enough? Or are we underprepared? Are we taking enough measures, or we are joking with the looming catastrophe? After the break, unfiltered opinion from journalists that come face to face with reports on coronavirus that both see the light of day and get shelved. This is Metropole Debrief special edition of Meet the Press, and after the break, you'll be meeting the press. Remember to be a part of the conversation 20146. We'll see you after the break.